I think varicose veins is a very satisfying operation to do. We can more or less get rid of all the veins that are unsightly and prevent, complications and worsening of the skin condition. Hi, I'm Dr. Chen. I'm a vascular and endovascular surgeon. I trained mainly in Singapore and I did rotations at NUH, SGH and Khoo Teck, and I worked mainly at Ng Teng Fong for the most of my career. And in the last year, I have started private practice at the Vascular Interventional Centre. We've estimated that more than half the adult population will have some form of varicose veins in their lifetime. Varicose veins are actually just stretched out, dilated veins, swollen veins. Can happen in the arms, on the legs, or anywhere in the body, but typically we see it mostly in the legs, where the pull of gravity tends to pull the blood mainly in the lower limbs and stretch the veins out more. Varicose veins is just a subset of actually the bigger condition which we call chronic venous insufficiency. So this encompasses varicose veins or spider veins to like limb swelling, skin hardening and darkening, and to something what we call venous eczema.
A bit more about the symptoms and at what point the viewer, if experiencing this, should seek.
Okay, symptoms for varicose veins can range quite widely. Simple ones would be just a cosmetic issue. You have ugly, bulging, bluish veins on the legs, and then as it progresses, it leads to like leg swelling. And then sometimes even the skin changes, the skin gets hardened, darkened, gets very dry skin, they get itchy skin. In the late stages, they can get ulcers, can actually develop wounds because of varicose veins. And then some veins which are too big can also bleed, can burst. Some patients present to the A&E with persistent bleeding from a high pressure varicose vein.
Could you walk us through the steps of the typical?
Varicose vein surgery these days is endovascular mainly. Gone are the days where we do open surgery and we pull the vein out, which leads to a lot of bleeding, a lot of pain. There are many modalities to treat the veins. There's heat ablation, there's laser, there's glue, there's chemical ablation, there's mechanical ablation. So we usually use a combination of these modalities to treat patients with varicose veins. Generally, the heat and the laser is used for bigger veins, the ones which are quite large, and then the chemical ablation can be used for slightly smaller veins, and then for those with very minute veins, more for cosmetic purposes, we use superficial lasers for that as well.
When would you recommend, at what point would you recommend surgery?
Varicose veins, generally, it's a lot of people may think that it's a cosmetic issue, but actually, if you do not treat it early, you get complications like leg swelling, skin hardening, skin darkening, ulcers, and bleeding. At that point in time, when you want to treat, the results are not the best. So actually, the best time to treat is before you develop the complications. When you notice any veins which are bulging, that's the time to seek medical treatment, medical advice. And simple things can be initiated like compression socks to prevent it from worsening. Not everyone definitely needs to go for surgery, but definitely seek treatment earlier.
Okay, so if I'm a patient, can you tell me what are my risks and my recovery?
Risks for developing varicose veins, generally there's a genetic component to it. So if a person has a family history, as in parents or siblings have varicose veins, there's a higher chance that they will also develop varicose veins in their lifetime. Sedentary lifestyle involving prolonged sitting or standing also leads to varicose veins, because the problem with veins is they are low pressure, thin walled. They themselves do not have the ability to force the blood back to the heart. They actually rely on the external muscle compression to push the blood back. So if there's no lower leg movement for a long period, blood tends to pull in the legs and stretch it out and cause varicose veins. We do know females tend to have a higher risk as well. Number one, because of the hormone estrogen, which makes the veins more easily stretched. The other risk is, of course, if there was pregnancy, the pressure on the uterus also tends to impede the flow, the return of blood from the legs.
Are there any other companions that prevent a patient
Okay, yeah. So, like I said, risk factors for varicose veins would be prolonged standing and prolonged sitting. Unfortunately, many of my patients can't avoid that due to the nature of their occupation. So, in those instances, I do recommend that they wear compression stockings throughout the day, during the daytime, to prevent the pooling of blood in the leg and to reduce the risk of developing varicose veins and the subsequent complications. Other than that, maybe regular exercises. If you're going to sit in the office for a long time, maybe every half an hour, get up, walk to the pantry, get a cup of water, do some calf pump exercises. That usually does help as well.